Welcome to Savvy Business, Life Unscripted, with your host, Christina Rivera, where our guests share their wisdom and valuable business tips, empowering our audience to expand their personal potential.
Hi, Dr. Elliott Trotter. Welcome to Savvy Broadcasting, Life Unscripted. I am so grateful to have you here this wonderful afternoon. We're going to talk about, pleasure to have you here today, Dr. Elliott. Trotter. We're going to talk about your wonderful technology, ScribeNest, transforming healthcare and helping emergency doctors and all doctors out there with the data collection that is extreme. But before we go to sharing all those wonderful details, I'd love for you to give a little background to our audience about how you came to creating it and where you are today with it.
Sure. So I'm an emergency physician for the past 35 years or so. I originally this documentation burden that we have as in healthcare sort of came into effect in about 1995, and that was in paper systems, and it was there. It was a little bit onerous, but not nearly as bad as it is with the electronic health record. So back then, I invented the modern scribe. So I started with 5 TCU pre-med students, just in Fort Worth. And then it sort of caught wind across the Metroplex, and then people started to hear about it from across the country, and we just really wanted to take that burden of documentation away from the physician and just allow them to interact with the patient. And so it was seen as a luxury in the paper world, and continued to run that company until about 2008. And sort of got out of it for a while. But it was a great symbiotic relationship. The reason I built that was to, help the physicians and also help those that were going into medicine, whether it's nursing, medical school, PA school. We even have pharmacy students and physical therapy students, just all of those who are wanting to get, into the healthcare field. This is a great way to do that. And so from that original time, probably about half of our physicians now in our ER, which is the 6th busiest in the country in Fort Worth, is now about half of those are former scribes who are emergency physicians now. So who knew when I created this concept way back when that these pre-meds were going to go off to medical school and then come back and want to come home. We also have a lot of emergency nurses that were our scribes in the past. Yeah. So about a year ago, decided that that sort of original concept that I had about that mentorship and that symbiotic relationship had sort of been lost. And so I got back into it to create that sort of mom and pop feel for the scribes there. Yeah. Also, as a background for a long time, I've been sort of a wellness expert and have sort of shared that. But long before it was kind of a buzzword and a thing. And, over the past 5 years, I've become much more involved in that. I've been involved in national committees as well as DFW committees and the local medical societies to help physicians and other healthcare workers with that burnout. And, as you guys are probably aware, one of the top 3 reasons for healthcare workers to be burned out is, in fact, the documentation load that the electronic health record brings on. So paper world seen as a luxury. Now everybody must do an electronic health record. And each year there's about 10% more and more documentation that we have to do. And so, able to teach the scribes what those things are and sort of help to unload that burden off the physician, and yet, still provide a great education. And by the time these guys get into medical school or nursing school, they have such a huge leg up on anybody else in their class, because they just have so much more exposure to terminology and workflow and, how to, interact with other healthcare workers, et cetera. So it's a pre-med, pre-nursing experience that can't be beat, for sure. And at ScribeNest, we really focus on what had been lost, and that is that symbiotic relationship. So that's kind of how we got there today.
Wow. Dr. Trotter, this recalls back for me. I was at a general practitioner of mine, wonderful doctor in New York. He had said to me, he was like thinking of quitting medicine because of the overworkload with insurance and paperwork. And he's like, I came into this to help people with their health. And I find I do like over 50% on paperwork. And no doctor signs up. I signed up to help people and learn the art of medicine, not to sit here and just do paperwork all day long. Now, you said that each year it seems like paperwork and documentation gets further. Is it like new government regulations or something? Like what causes that?
New government regulations. Somebody has an idea that they think that we ought to be, put this onto the physician to document. So maybe we can do a study, or maybe we want to make sure that that we're following all the people that have a certain issue. But yeah, each month I'm involved with a committee for the electronic health record for all of DFW, some 17 hospitals, and each it feel like a hockey game, because each month there's probably 10 shots on goal of somebody trying to get us to, come on, doctor, it's just a few more clicks.
Oh,
well, that's 30 seconds. If you're seeing, maybe, 20 to 30 patients, that can be, up to 15 minutes.
Mm-hmm.
And so you do that, each month, and all of a sudden you've added, hours to every day. And so, as you mentioned, like your friend, documentation is huge. Most physicians end up going home and doing an additional, amount of documentation once they get home. And so that's what scribes do, is they help you keep up with that documentation. And for me, I never document. I never finish any charts at home. I always do it while I'm still at the hospital. That's fresh. And so we'll wrap up those charts usually about spend the last 30 minutes after we're finished with all of our patients, sort of knocking that out. Whereas a physician at large without a scribe typically will spend some hours doing that. So yeah,
that's pretty nuts. That's absolutely nuts. I can't believe it takes that long, and what doctors have to go through doing that. Now, to fill in people what scribing looks like, is it kind of like medical dictate, like you're dictating all the notes or what the patient talks about, their history? I mean, what does it look like as far as what a scribe has to do?
So a lot of people have, my original concept was that was only a third of their job. Mm-hmm. And so the other 2/3 is sort of being a peripheral brain, as I call it. So some healthcare workers today will use a scribe only for the documentation piece, and potentially just as a human dictaphone, and they'll run and see patients, and the scribe sits and they'll come dictate, and the scribe will do the note from there. Maybe they'll go to the room and sort of do the chart live. But that's only about a third of what our scribes do. The other 2/3 is they're looking for abnormal lab tests, like, hey, this is back, this X-ray's back. Do you want to look at it? Is this broken? And so they sort of help you with your flow. And there'll also be someone who the nurses can tap on the shoulder and say, hey, Trotter needs to go, talk to this family. And so they're kind of in charge of sort of telling me where to go, and I can just focus on the patient care. So it's a pretty cool system. But yeah, they're at elbow support. They're in the room with me, and they're documenting real time. They're helping me, sort of, what at the patient's pharmacy has changed. They're inputting that data. Just any of those sort of things that you could delegate to someone else to really help. And it's all about the patient's interaction as well, because if you go to a physician's office and they're off to the side typing away while they're supposed to be paying attention to you, are they listening to me, or are they, what are they doing on that? Or if they're on their phone, they might be doing something related to you, or it might be, are they texting a friend or something? So it really allows you to have that, eye contact with your patient. So it's really built for patient satisfaction, physician satisfaction, staff satisfaction, and of course the scribes as well. And that's what ScribeNest, that's why I brought that back, is to really focus on that, because the art of that had definitely been lost about that symbiotic relationship.
Yeah. And when you talk about that symbiotic relationship, it's really building that relationship and partnership with the patient. And you can't do that if you're distracted by all this silly admin or documentation stuff, and then you're losing track. And it's kind of like having a personal assistant with you at all times. I love that, because then they can catch. Now, I forget what channel I was listening to, but there was a medical student who was following a doctor on his round, and there was something he noticed about this one patient where he had an issue they couldn't figure out, but he was like making rounds on his own, the medical student, and noticed that this guy was having his wife bring in like 2 cases of soda. He was on the edge of diabetes. And so they couldn't figure out, we're looking at the chart, we're giving him good food, no sugar. Why the hell is things not getting better? And the medical student was able like, yeah, this might have something to do with it. I saw like, so yeah, it's great when you can have a scribe go like, yeah, I might notice this information that maybe you didn't have that could help you out here. Yeah.
So our scribes do more documenting than most medical students do, because medical students usually are only documenting on maybe a couple of charts per day, maybe 5, but our scribes are documenting on several. They also work with several physicians, so they learn a little bit of nuances about how they want to come across to the patients, right? So are they going to be, I like the way Trotter says that, but I like the way Dr. Jones says this. And so they sort of incorporate that. And so our physicians that were once scribes, almost to a person, there's a few outliers, but almost to a person, have great nursing interaction skills and great patient interaction skills, just because they've seen it done different ways by different physicians. And what you're talking about, this peripheral brain thing, I've had 5 medical schools call me over the years and say, hey, I've got this student. She's a first-year medical student. She's never seen a patient before. And we're doing this didactic class where we're, talking about a fictitious patient who's having a headache. And this first-year medical student, she's getting all the right answers, and she knows all the right tests to order and all the right medications to give. And yet my second-year resident, who's 6 years her senior, doesn't know half of what she does. What is this? She said she was a scribe for a year. What is that? I said, well, this is how medical school was done 100 years ago. So
really?
Instead of just sitting in a classroom for the first 2 years of medical school, you're actually going out and you're documenting, you're involved. What the medical students typically do now is they're just sort of doing observation stuff for the first year or two, where they're just sort of in the room and they're watching what's going on. But it's a different thing if you have to actually document it, because you have to understand what the words are and what's happening, and you're not just a passive thing, you're actively involved. Our scribes also, their grades almost always improve because of their ability to take notes. I mean, you can imagine this chaotic environment and you're taking yes, no answer questions and creating paragraphs. So now when they go to class and they're in organic chemistry or whatever, their ability to take notes is they're absorbing it real time, as opposed to most were just kind of taking notes and then going to study it later. So they are able to absorb stuff much more real time. They also learn time management, because they're going to go work 8-hour shift. Our scribes work about 20 hours a week as a minimum of the part-timers, and so they're able to say, okay, I've got all day Saturday to study for 12 hours. And, they do a little social media and all this and call. So they may get 3 hours of studying done. Now they've got an 8-hour shift. So they're going to go work a shift, and then they know they've got 3 hours to study. So their time management skills are vastly improved. There's several different things that make it a real cool environment for scribes to sort of become much more mature. And so it's sort of fun to watch. And a lot of them have kept track with me over time since I started that in 95. And so it's a cool the sort of thing.
Wow. I love this, Dr. Trotter. This reminds for me, someone who was talking to me about her becoming an apprentice, and that kind of following along, not just sitting in the classroom, but actually being in the environment you're ultimately going to work in, and getting the whole picture. Because it's one thing to sit in the classroom, get all this on a board, memorize the book. It's not the same as being inside of the environment and becoming, it actually ingrains into you. And as you said, it makes you in this case, a better doctor in the long run, or nurse.
Yeah, for sure.
Wow. This has been, so when you had this idea, you said that over 100 years ago, this is how medicine used to be done. Why did it change? Why did it go to a different kind of in-classroom thing? It seems like this would be a much better way to run things.
Well, they just immediately, when you got to medical school, you already had patient interaction stuff. And I will tell you that medical schools have sort of learned this. And so instead of, having medical students see patients at year 3, right? There's 4 years of medical school. They would typically start year 3. Now they're doing it a little bit like maybe 2.5, maybe, but it's still, getting them involved in documenting is just, it's just not there. It just changed because there was so much information, and to make it sort of standardized. So before you would just sort of hang out with a physician and sort of learn, and you'd have textbooks and stuff. And now they need this volume of material they have to get through. And, but those first two years, if you're just in the classroom learning about, biochemistry or pharmacology, if you're out and seeing pharmacology or seeing those medications used, it's a lot more, it's like learning a foreign language to learn pharmacology terms, right? These medications. It's like, what is that? And he said, I've used Rocephin before. That's an antibiotic we use to treat urinary tract infection. So, when you're learning in the classroom, it has a connection there. So you learn what that is.
A real world experience. Yeah. Not just in the book. And, it's interesting because I'm thinking over time, this begins to make a lot more sense when you're actually living it and experiential learning, as it were.
Correct. And it's very motivating too. So it's like, I really like this. And I'm kind of smarter than these medical students who are following along. And so I'm definitely, motivated to go to medical school or nursing school or PA school. So it sort of confirms that this is the trajectory that you wanted to go on. And a few, they've decided, this is kind of not what I thought it was. And so maybe they'll go into a different sort of realm. Some of them will become hospital administrators, et cetera. So, and being in the emergency department, which is all that we do, it's exciting. It's, you really feel as a scribe that you have an impact on a patient's life every day, a physician's life every day, nursing staff. So you really feel like you're accomplishing something because you are, as opposed to in a clinic. Yeah, it's a little bit repetitive and maybe not feel like it's that you're really having a change of a patient's direction, to change their course and potentially even watch a life be saved. Where else can you do that? That's a whole nother, I could talk for about an hour about how healthcare workers, they have such a great ability to help people. And this burnout thing, they lose that sort of love because they're so distracted by all this other stuff. I got in this to help people. I'm an empath, and now I'm distracted by all this other stuff, and that's what's taking my focus away from what I really love and want to do. Yeah. But so they really get to enjoy their environment, and that's what it's all about. But paying it forward is definitely what life is all about as well. And so what a better way to do that than to influence the next generation. If you think about it, what an incredible, immortal impact you're having on generations to come of their, not only their education, but also how they, interact. So, this is all in the emergency department, but you can also see what a trauma surgeon does, what a cardiologist does, what a radiologist does, neurologist. You can kind of see different specialties and sort of hang out with them a little bit to kind of see, emergency medicine is kind of intense. It's not predictable. So for the really hard type A personalities who like their life, in boxes that's very organized, this is not that. It's sort of like orchestrating an orchestra in chaos, so it's managing that. And it is a managed chaos. And so I still thrive on that after doing this for 35 years. So, and that's what I sort of try to pass on as well, is how to, that's unusual because probably 80 to 90% of physicians at some point in their career will have some sort of burnout. We call it a moral injury is another term for that burnout term. And so what is it that a handful of us have been able to do that allows us to look forward to going to work every day, even after doing this for decades? So, but that's a talk.
Yeah. Well, I love that. I love you're saying that, people who go into scribing will not only get to see different parts of medicine, see where do you best fit, but to see, do I fit in this industry at all? Or maybe in as you say, maybe in administration or something, not on the front lines. And it's great because that way you don't waste a whole medical degree to go like, oh, I hate this, get your whole degree. I'm a doctor, but now I don't want to do it. So you definitely don't want to get there after spending God knows how much on your education.
So how many accountants do you know that went into accounting because they love math?
Yeah.
And then they get there and they say, "What? This is
not math.
This is adding and subtracting. This isn't that fun calculus stuff, So, right? And they may not have ever followed an accountant around for a day or a week to really kind of see what it's all about, right? So,
have you heard of Dr. Trotter? Vocation vacation. I don't know if it exists anymore, but it used to have an idea that, say, you were a young adult or an adult that had this idea for a career change, you could hang with someone in that career for a week. You have to pay them. And you would kind of just follow and shadow them to see what it's like inside of that career, like whether you're going to follow a lawyer around for a week or whatever. So I thought that was a great idea. And I think we should bring that to high schools. I mean, if anyone's interested in pre-med in high school, bringing scribing there and letting them follow in some capacity and do that sort of thing would be great to get them started for even pre-med. That would be fabulous.
Right. I mean, it does start, it definitely starts at that level. And also what also starts at that level, it's been the focus of creating resiliency to prepare you for that almost inevitable burnout after your career sort of starts, or maybe in residency, maybe medical school. I think it needs to start when you're in college, when you have the ability to learn these sort of techniques that are a healthy way to have a balanced life. Because it's hard to do to sort of learn, let's say yoga or meditation or whatever when you're in the throes of a busy life, right? You already need to have all of those sort of things already available to you so that you can call on them when you need them. So
makes so much sense. Well, you've given so much food for thought. If anyone listening in ever thought of going into the health arena or becoming a doctor or working in the industry, I think listening to this interview today and finding out more about ScribeNest, how can they find out more about you or work with you guys? How can they do that?
So ScribeNest.com is our website, and at this point, we're only in the DFW area. So if you know of anybody who's in the DFW area that's pre-med, pre-nursing or whatever, reach out. And you could certainly reach out there as well if you wanted to get in contact with me. It's trottermd at scribenest.com. But you could also hit it just directly.
Awesome. Well, Dr. Trotter, I just have to thank you again for all the wonderful work you're doing. You're saving so many doctors. I don't want my doctor friend to leave medicine. He loves it. And I'm hoping you'll save many others out there from burnout. Thank you so much for coming to Savvy Broadcasting today.
You're welcome. Have a great day.
Good
to meet you. Thank you.
Looking for a hilarious read? Well, check out my latest book, My Crazy Roommates. The names have been changed to protect the deranged. Step into the wild and unpredictable world of young adulthood in the heart of New York City. Brace yourself for a roller coaster ride through the trials, tribulations, and hilarious moments of shared living spaces with a colorful cast of characters. Fasten your seatbelt and get ready to laugh, cringe, and maybe shed a tear as you delve into the pages of My Crazy Roommates. So get your copy today, available at Amazon.com.